Hello, welcome back to Bendy Menopause. I'm Vanessa Wiley, nurse practitioner, clinical hypnotherapist, Menopause Society certified practitioner. I'm the founder of Phases Clinic in Washington State, and I'm here with my old pal, Cherie Pfeiffer. She's a licensed mental health counselor and owns Old Growth Art Therapy and Counseling, also in Washington State. You're only licensed in Washington, right?
I am only licensed in Washington.
So Cherie is an art therapist, but also trained in EMDR. And I've had
Mhm.
quite a few patients that have heard of EMDR and are interested in learn more about it. So I thought she'd be the perfect person to bring alongside here. So first of all, how did you first get interested in EMDR and even learn it was a thing?
Well, when I was in grad school about 12 years ago, I had heard about it as one of the evidence-based big names as far as like trauma processing was concerned. And I was always interested in trauma therapy. I did a lot of work before I went to grad school with kids in crisis. And I always found it like it always felt very poignant, I guess.
Mm,
And so I went through grad school. I finished grad school. I did a few jobs after before I became fully licensed. And I was doing a combination of, I was obviously doing art therapy, and art therapy is also really wonderful for trauma and integrates really well into other modalities like CBT and DBT and all that. So I was using sort of an integrated combination of those therapies and it was working and I was doing great work with clients and but I always felt like there was something missing as far as like my own skills and like my own interests were concerned. And when I became fully licensed and I started working in a residential facility in Fort Townsend, Washington, I was given the opportunity to take EMDR level one training through my employer.
hmm
And I found it just so wonderful and it felt intuitive to me. It made sense. I had my own experiences when I was practicing with other therapists of experiencing the effects of EMDR and like how it worked for me. And it was much faster than than any therapy I'd done or any therapy I had received.
Like the transformation piece felt faster.
Yes, absolutely. And it was, it was hard, but it was also, I felt like within my capacity that it was like coming out the other side felt so just, I felt so much wildly, so much different. And I started using it in practice at the residential facility and took it with me when I opened up Old Growth Art Therapy and Counseling. And I've continued to see it work really well with my clients. And so it's a wonderful modality.
For anyone who's never heard of EMDR and doesn't know what we're talking about here or thinks it might be dance moves, can you just explain what EMDR is?
Yeah, so EMDR is short for eye movement desensitization and reprocessing. It was a trauma therapy developed by Francine Shapiro in the 1980s, I think. I'm not 100% sure about that. But essentially, there's sort of a story that they tell you in level one where Francine Shapiro was taking a stroll in the park and she had some things on her mind and she found herself pretty troubled. And as she was walking
Hmm.
along and she was looking outside, she noticed that she started to become sort of inherently calmer and a little bit more regulated, meaning that her emotional state, I guess, went from being fairly stressed to kind of feeling more in control, a little
hmm
more in calm. And through her research and development of this model, created this sort of treatment where individuals historically in talk therapy had come to therapy, they would talk about their problems, they would do worksheets, they would do a lot of thinking, and they would feel, but they would think too, a lot of thinking and talking. And over time, that model said, like, if you talk about this enough, if you think about this enough, if you feel about it this enough, then transformation will come. But with EMDR, there's actually very little talking. It's an 8 phase model where that begins with taking sort of a general history of a client's background and what they may have gone through, including a general idea of whether or not they've been through some traumatic events, but we don't go too deep into it at that phase. It's just kind of like, what's the themes that we're dealing with here? But we spend most of our time actually building up resources, which are what resourcing means in EMDR is creating methods to contain our emotions, to build our window of tolerance to dealing with distress within sort of like a controlled manner with some psychoeducation and all of that. And then spending the rest of the time, after doing some researching or resourcing and history taking, identifying sort of a target to work on. So a target could be a single traumatic event or just a memory that is extremely troubling something that there's that a theme, again, going back to themes, right? A theme of something that you're struggling with, such as feeling sort of helpless or hopeless or low self-worth or feeling alone, and essentially following a thread so eye movements is part of the name, but it's not actually exclusively eye movements. Essentially, as you're sort of thinking and feeling about this target, you're also doing some things that we call bilateral stimulation, which is essentially engaging both sides of the body, the brain. Eye movements is the classic way, but there you can also tap your body. There are buzzers that some people use. You can even toss a ball back and forth between your
Mhm.
hands. You can walk, you can sway. There's many different things. And between utilizing bilateral stimulation with your therapist guiding you
Mhm.
and following the thread of the memory, clients end up in a place where formerly they felt worthless or alone or extremely disturbed by a traumatic event that they couldn't move past, to a place of a more settled, peaceful, resolved place. So it doesn't take away what happened to you. It doesn't take away the reality of the situation, but it does help us sort of let go of that residual pain and negative self-worth that tends to go with those things. Does that make sense at all?
Yeah, you and I have talked about how there might be some overlap in hypnotherapy as well as
Yes.
like this idea of maybe finding an outlet to help release trapped emotions.
Yes, absolutely.
So
Yeah.
a lot of people who find my channel have hypermobility or are neurodivergent or have, things that they've been living with lifelong, but oftentimes have been dismissed, told it's just anxiety, it's all in your head, whatever the case may be. And so I have quite a few patients that are working through medical trauma. So I'm curious if that's something that you've seen EMDR be helpful for specifically.
Yes, I absolutely have. And if anyone is interested, or if you're interested, there's actually a EMDR practitioner and researcher named Mark Grant.
Mm-hmm.
He has a lot of wonderful resources, both free and paid, for folks who live with chronic pain. And I've personally recommended a lot of his resources to my own clients with chronic pain and medical trauma as well. And they've found it fairly helpful. So,
Yeah, I think you
yeah.
mentioned him to me before, and he even has I think he has some free things on YouTube with the bilateral sound. So that's
Yes.
a good way to dip the toe in.
hmm
So my understanding is when this was first developed, it was really more designed for like a discrete, very clear traumatic event, like your house catches on fire, something like that. But we're kind of
Yeah.
talking about cumulative trauma
Yes.
or
Yes.
ongoing, even maybe currently ongoing trauma. Has EMDR been adapted for those situations?
Yes, absolutely. So the 8 phase model certainly can be used for many different kinds of trauma, but as the field has sort of discovered, like, single event traumas, it land differently in the body
Mm,
than repeat constant trauma. And
hmm
it's even more complex when you have repeat complicated trauma in childhood as well. So, as a practitioner, we want to be really mindful during the history taking phase that as we're sort of exploring clients' backgrounds and the themes of kind of what they're struggling with and feel stuck with, that we be really mindful about what kinds of traumas we're actually targeting with
mm,
EMDR. Because, our job is to be attuned, right? Like any kind of therapy or treatment cannot meet our needs or meet our goals if we're not approaching the client with the actual need that they have, right?
mm-hmm.
Yeah, so we would approach more complicated, longer, repeated event trauma differently than I would a single.
Have you had clients where you feel like EMDR is not the right choice for them?
Oh, yeah. Well, so I will say that I think that clients should have the right to make decisions like this for themselves. And sometimes just like mental health medications or like physical health medications, some medications work better for others, right, than others, right? And
Mm-hmm.
for different people. And so our job kind of as a therapist is to balance kind of both our experiences and our belief in the model and like our educational level and all of that stuff with also the client's needs and the client's wants. And what I have found is that a lot of times the clients who don't want to use EMDR or feel like it's a little bit too much for them have had bad
Mm-hmm.
experiences with other kinds of trauma therapy or even like with a past EMDR practitioner who didn't quite attune to their needs.
Mm,
And there's also a myth within the EMDR community that EMDR can't be used with certain conditions like severe dissociation, which is
mm,
a symptom of trauma. And what we've found through research and through experience is that you can do EMDR are with dissociated clients. But you, again, going back to being attuned to their needs and making sure you're meeting them where they're at and making sure it's a consensual experience, you know?
Yeah.
Mhm.
And that makes a lot of sense, even in healthcare. When we think
Mhm.
about that trauma-informed approach, the key to it is just making sure that people feel like they have a say in what's happening.
Yeah. And I think like, and I imagine that this is probably something that you might have seen it too, where a lot of the times, one of the reasons why trauma is so sticky is because a lot of people who've survived traumatic events, either single or multiple events, oftentimes have part of the side effects of that trauma has been that they've had a choice taken away from them.
Mm,
And it's super important as practitioners for us to make sure that clients remember and feel that they have a choice and that they have some control over the process of what we're doing instead of trying to lead the process ourselves without checking in with the client and making sure that they have a say.
Yeah, it sounds like this can probably be pretty emotionally taxing for people. So when you have somebody with chronic illness, spoon theory, like they come to you already feeling drained, how might you approach it?
Well, so I first we would probably do, well, again, going back to like, what's your history? Like, what kind of therapies have you been through before? And also getting a sense of, so I love spoon theory, but I don't think that spoon theory speaks to the different kinds of fatigue that we might have because something that might fatigue my body but energize my brain, or I might have something that fatigues my brain but like energizes my body. Like, there's different domains of fatigue, as I'm sure a lot of, especially folks with chronic pain and illness, can probably, identify with. So
Yeah.
when I do therapy with folks and we start in sort of the preparation phase of everything, we would do a pretty solid assessment of what does capacity look like to you?
Hmm.
And do you have the same capacity every day? And most people don't,
No.
even if they don't have chronic pain. Exactly.
Right.
Like, some days I have like all of the spoons and I'm ready to go. And then there are other
Hmm.
days where I could barely like go to work and show up and then come home and crash. And so being mindful about finding a shared language with clients with chronic pain and illness to build sort of a shared understanding of what their capacity looks like, what's manageable for them, what is possible for them day to day. Yeah. Again, going back to like that sort of shared understanding, that attunement.
For the phases, is there like a recommendation for how frequently you should meet?
Generally speaking, I'd say once a week.
Okay.
Yeah, you can do it more frequently or less frequently. There are intensive models where you can attend an EMDR intensive as a client for a couple of days
Hmm.
and or like intensively doing. So you can attend once a week. You can do once every other week if you want to. You can also, if the therapist, has the capacity for that, you can also attend intensives where you spend either an hour very intensely doing EMDR or longer days where you spend multiple hours doing EMDR and resourcing and all of that stuff with a trained therapist. And intensives are fabulous, can really move things along really fast, but they do
Yeah.
tend to be expensive and are not always covered by insurance. So,
hmm And
hmm
probably even more draining.
hmm
Something I find for myself and a lot of my clients who are, flexible or hypermobile or neurodivergent, they might have unreliable interoception. That's like
yes.
a sense of what's going on in your own body. And I
hmm
think to some degree, EMDR relies on that. So does that complicate how EMDR can proceed, or how do you work with that?
Well, poor interoception or struggling to have interoception as a client can definitely be sort of a hurdle for clients and therapists to move through. But with a good practitioner who is trained and informed in this kind of thing,
Hmm.
there is some element of interoception that can be learned. And so finding the right therapist who has the training and the skills, or even might even experience a similar sort of some of the similar symptoms to those clients, can relate on that level. Clients and therapists may be able to sort of build mindfulness around improving their interoception levels a little bit. It's also not uncommon for clients who've experienced trauma to have a level of dissociation from connection with their bodies anyway.
Hmm.
And so as practitioners, it's also our job to sort of help both us as therapists and also our client understand how much of this is dissociation and how much of this is interoception issues that we can build understanding around.
Yeah,
Mhm.
that sounds really challenging to tease apart.
It can be sometimes. Yeah.
So one factor that I often find a little bit sticky is explaining how pain is absolutely real, and yet we're thinking about treating a physical symptom using a mental health modality. And for a lot of people, especially those that have been dismissed before, that can be triggering. And
Hmm.
yet I want to empower people to know that they actually have a lot of control in,
Yeah.
through that mind-body connection of
Hmm.
influencing how they respond to pain or anxiety or other things.
Yes.
So how do you approach that
Yes.
conversation? I'm always looking for ways to pick, to work on that spiel because it's a really tricky needle to thread, I find.
It is, absolutely.
Like if someone's coming to you with a physical symptom they're wanting to work on and you're saying, hey, this mental health modality might be helpful, how do you approach that idea of mind-body connection without feeling
Mm.
dismissive?
Sorry, I'm going to repeat back what you said to make sure I
Mhm.
understand before I go forward.
Yeah.
So a client comes to me, says they want to use EMDR to help work on a physical symptom or a physically perceived symptom like pain,
Hmm.
right?
Hmm.
And how would I facilitate the mind-body connection with them, or how do I educate them? Am I
Yeah.
understanding it correctly?
Or maybe if you or another provider was to want to initiate that conversation around treatment modalities, including, a mental health piece when their primary concern is a physical symptom,
Right.
particularly when they've had history of dismissal.
Yes. Okay. Thank you for clarifying that. I just needed to make sure I understood before I went on a speech. Okay, so I have this conversation actually with all of my clients. So it's because there is, I think, only fairly recently over our, Western culture, medical and mental health sort of history, have we really started to actually really understand or start to understand the fact that what's going on in our minds and our emotions affect how our body feels and vice versa. And not all of it is conscious.
Yeah.
Most of it's not conscious, actually. And that building up first an understanding of what's happening to us physically can inform how we're doing mentally and also vice versa. So sometimes how I'll facilitate this conversation is I'll normalize that, what we're thinking and feeling in our minds, and like even our body language, right? Like
Hmm.
if I'm feeling kind of defensive and a little closed off, I might cross my arms, I might look away, I might kind of close in on myself a little bit. And I mean, that's not to say that like sometimes people just cross their arms because it feels comfortable for them, right? But it's about kind of like the combination of multiple things. And when I physically close myself off, like I'm doing right now, I already notice that I'm starting to hold my breath a little, noticing that like my mind is sort of shutting off the faucet is being shut off a little bit. Like there's sort of some tightness. I'm noticing some tightness. And when I change my body language, I open up my arms again. I sit up straighter. I take a couple of deep breaths to feed some oxygen into my body because I've just been holding my
Hmm.
breath. Like, what do I feel? Like, what am I noticing about what I'm thinking on and how I'm feeling? Like, I might feel a little more confident or I might feel a little more calm or a little bit more open. And when it comes to experiencing chronic pain, and especially with that like medical dismissal that so many people have experienced, there's both the physical symptom that you want to treat, right? Like, I live with this pain all the time, but also there's also this part of us that's like, is this person going to listen to me? Is this person going to take me seriously? Like, is my pain real? Because
Hmm.
everyone's been telling me it's not, right?
Yeah.
And so some of the work that we would do together is by building up some sort of connections between what is happening with your mental health when you're feeling a flare up. Like, what are some of your like do you feel 100% mentally, or do you feel like anxious or depressed or hopeless, or all of those things that those descriptive words that we might use? And how does that impact your pain? Like, are you able to access your like, are you drinking water? Are you eating food? Are you able to eat food? Like, are you able to access those things that make those resources that you have already that might make you feel good? Like if I'm having some pain and tea relaxes me, but I'm having a particularly bad flare up and I'm having a hard time getting out of bed because I'm feeling so dejected. I'm not going to go and make a cup of tea, and I'm not going to have that moment of self-care and building some spoons because I have.
Yeah, I had a similar experience as a patient where I was working with my lovely hypermobile PT, Sarah Woodward, which now we share clinical space. So I'm not her patient anymore, but I was telling her I was doing home health at the time and telling her the days that I'm driving all over the place doing home health, my pain seems to be more flared, and I'm kind of thinking like arm position as I'm driving or lugging the backpack around, very physical things.
hmm
And
hmm
she kind of gently suggested if maybe those days are also more stressful, maybe constantly being in a new environment and like having a little bit of an unknown about what I was walking into every day, or dogs barking, if that could be
hmm
layering in there. And, there's days where I drive just as long, but I'm going to go on a hike and I don't have the same pain because yeah, so
Exactly.
just that physical input. So
hmm
yeah, sometimes just reflecting back to people can be quite helpful. And I just hope people can have a bit of an openness to that idea. I
Absolutely.
really think it can help with the healing and coping.
Absolutely.
So, how does somebody actually find an EMDR therapist? Because I don't think it's super common for therapists to be trained in this, right?
Yeah, they're not a dime a dozen, but they are definitely
Mm.
out there.
Yeah.
So probably the most reliable way someone can find an EMDR therapist is to go to the emdria.org website. And EMDRIA stands for International EMDR Association. And that's the association that I am certified under, and I'm working on my consultant credential at this
Oh.
moment. Yeah. So there is a therapist directory there. Not every therapist that's trained through EMDR is on that directory, but a lot of people are. And if you are looking for someone who's experienced, you're going to have probably better luck if you seek an EMDR therapist that has an EMDRIA certified credential.
Hmm.
So you can find them on the EMDRIA website. You can also look through your insurance if you're looking to have insurance coverage for your therapist. Most insurances will make the therapist credentialed under them have to check what modality they use or what treatment focus
Hmm.
they use, or they can
And
ask their doctor.
I know that you are knowledgeable about people that are hypermobile and neurodivergent. Maybe not every therapist who does EMDR is. So, is there anything you would recommend that people make sure to share with their therapist to help?
Yeah. So I would look for a therapist who does consults before starting therapy with them. Doing a short consult over the phone or over video can give the therapist and the potential client an opportunity to just sort of feel each other out and ask questions
Hmm.
without having to commit to a full session. And I would certainly, if I were to sort of advise clients on what to look for, I would say look for therapists who indicate on their profiles more than one specialization or areas of focus and what you're looking for. So if you're someone who's hypermobile and has chronic pain, there's a good likelihood, though it's not 100%, that that client would be neurodivergent as well. So looking for EMDR
Hmm.
therapists who have training treating people with chronic pain and neurodivergence, being really kind of explicit about the kind of symptoms you have, asking the therapist about their training, where they've gotten their training and what their interests are and how they conceptualize working with chronic pain, and also kind of going with your gut regarding like what is this therapist saying, what's on their profile, and do I feel like this is going to meet my needs.
The audience for this is somewhat split. We have some healthcare providers, some potential, lay people. And so is there anything that you wish other providers understood about either this modality or caring for these clients?
Yes. Oh boy, do I. I think that there are still some assumptions about treating neurodivergent clients from practitioners. Like there's an immense amount of progress and understanding made, in this field over the last 20 years that we've come so far, and not everybody's caught up, and I don't expect them all to be, right? So my thoughts are kind of like, to summarize, are that I think that there are some new practitioners who may feel a little intimidated about treating this population because most therapists, most practitioners trained in EMDR really want to help. They really want to do it the right way.
Hmm.
And with clients who have complex histories, chronic pain, like, the thing that is tough for us as practitioners who want to help with the pain is that there's some element of chronic pain that we just can't control, right?
Hmm.
And so I think some EMDR therapists, especially new providers, might feel a level of fear or misunderstanding about treating clients with this level of trauma and stuff. So I would say, I think that our field in general, that we should probably, as educators in the field, should continue to be sharing and keeping these resources open for new practitioners to learn and also feel more confident in treating this population. because EMDR can be extremely effective for this population. I think a lot of practitioners kind of get caught up in like there's different protocols in advanced EMDR for different things. And a lot of practitioners are like, I need the right protocol. I need to know exactly what to do in a situation like this. And the thing is that with clients who don't have the single incident or just a couple of incidents here and there traumas, that the 8-phase model is still effective. It's just how do we adjust the 8 phases to meet client needs? Like, are we using, what kind of bilateral stimulation are we using? Can we get creative with that? Like, how can we creatively use resourcing to support this client in building up their confidence and their window of tolerance for processing and desensitization of the memories that they're coming to help us get unstuck from? And I think that we as practitioners, the more flexible that we can get and the more confident we can get with that flexibility, the better off we'll be treating clients that does with more complex presentations.
Yeah, I can confirm that as someone with hypermobile Ehlers-Danlos syndrome myself. I think for me and for many of us, like we're very familiar at this point that require a little trial and error. Don't always respond to those things the way other people do. And so I know on the medical side, a lot of healthcare providers like really would prefer to avoid hypermobile people because you can't fix us.
Yeah.
For us, we're like, I'm not looking to be fixed. I'm looking to feel 5% better here, 10% better there, have life so much more manageable.
Exactly.
I actually think in a lot of ways we're the best patients because we have very reasonable expectations as long as you do that expectation setting from the get-go.
Absolutely.
So the training that you're doing with EMDR, does that mean you'll be training other therapists?
So EMDR consultants under EMDRIA can provide consultation for new EMDR therapists to become certified and also to eventually become consultants themselves. I'm not going to be, by the time I complete my credentialing for that, I will not be able to be a trainer. That requires a lot more in-depth training that I don't know if I have the ADHD attention span for at this point in my career, but I love mentoring other therapists and helping build their confidence and their tool set. And I believe in the model a lot. So
yeah. Okay. So then we have two audiences that might want to find you. One are people who live in Washington and really want to try this modality for themselves. And then two are clinicians who are already trained but need that consulting piece. So how can people find you?
They can go to my website at oldgrowtharttherapy.com and find my contact form there, and feel free to reach out to me and ask me any questions. I'd be happy to hear from you.
Okay. So no matter what you're trying to reach out for, it's that same website.
Yeah.
Wonderful. Thank you so much for coming.
Thank you.
I'm sure that learning more about this modality will be so helpful for folks in this community. So thank you so much.
Thank you. Happy to help.
Bye.
Bye.